to say this: do 10 or do 4, but never do 6. And again, Matthew Perry's the poster child for this because the buccal corridors look pinched in. Now, one of the biggest problems is when people do 6, they also do color changes, and that's what really exacerbates this look. So let's talk about a situation, and I want to share this case with you, is that this patient's chief complaint is they're a little unhappy with the smile. What bothers them are the abfractions, and fortunately for me and her, that the color really wasn't that big of a driving force. So let's take a look at the smile. And, overall, it's not too bad. We've got some nice arrangement, but the centrals, again, aren't balanced. They're not symmetrical, so it looks restless. It looks unfinished. Well, what are we going to do? Well, let's step back. And let's go back to where we started. Let's start looking at the widths, the proportions. Okay? Is there a repeating proportion here as we go from central to lateral, lateral to cusp? No, there really isn't. But what if we decide to create a proportion? We talked about the red proportion previously. I want to share with you another concept by my dear friend Steve Snow. And I kind of like this concept. This is just a variation of the golden proportion, right? So to simplify it, what he does is he takes the assigned width of each tooth and divides by the total to a relative percentage. So when you look at the space between the central to the cuspid, right? If you create the centrals to be about 25% of the space width, the lateral 16%, and the cuspid 9%, these will actually allow for that nice dominant central look and an overall very pleasant smile. So if you're stuck, you're trying to figure out proportions, consider this percentage guide by Dr. Snow. And so using that, we can see that the width of the centrals presently isn't quite that ratio. So we're going to have to cheat a little bit. And so what I want to do in my proposal then is I ask myself, how do I want it to look? So I want my centrals not only to be longer in appearance, this will then require that they be wider so that the proportion width to length ratio is pleasing and it anchors the smile. Now, if I do that, and I like the position of the cuspids, that they blend, allow a nice transition into the buccal corridor, which they do, that means I'm going to have to cheat the personality tooth, the lateral. I'm going to have to move the lateral in such a way that it looks like it belongs and the proportions fit. And this is typically how I do a smile design. I anchor it with my centrals. I place my cuspids as the transition into the posterior teeth, and whatever space is left is how I fit my laterals. And this is where, having fun comes into place. So again, the red proportion, it's not going to be quite the golden proportion as you see on the bottom, the 62%. And it's going to be someplace in the 70 to 75% step down. But it will work if we get our centrals nice and balanced. So now when you look at the red lines, when you look at the proportions as we move distally, this is going to look very pleasing to the eye. All right. So let's also look at the functionality. If we're going to lengthen on a patient who has worn their teeth, we want to protect our new restorations. We don't want them to break. So if you notice, the protrusive is really just on this lateral, and then you get on the edges and start wearing away. And so this patient has a bit of a horizontal wear problem. So what are we going to do? Well, when we lengthen teeth and we don't want things to break, we have a couple of options. You can increase the overjet. This will reduce resistance as they move forward and back. Okay? Or you can reduce the overbite to minimize the amount of time they're in resistance, bruxing forward and bruxing back. Well, we can't shorten these teeth, right? Because we want to lengthen the display. So we're going to have to cheat and bring them a little bit more facially. Understand something. We talked about the morphology of the tooth from the facial, but it's important to understand incisal edge anatomy and morphology, right? Not only does the incisal edge create the appearance, the aesthetic appearance of the tooth, but this is where the function occurs. So when we look at the incisal edges of our anterior teeth, there are three components. There are the two bevels facial incisal and lingual incisal, and the incisal table, the flat top of the incisal edge between these two bevels. And it's critical to recognize this. Okay, this is where function occurs, out on the edge of these front teeth as we move side to side. This is the safest place for forces to be, on this table. So when we look at the wear of our mounted casts, and in this case, she has been equilibrated, so her CR and MIP are coincidental. And you can see the flat edges. You can see the facets that are occurring. In fact, you look at the adfractions that have occurred that you can see in the models. So let's evaluate this. All right, we can see that this patient is just moving horizontally and creating flat spots, crossovers occurring, and this is what's contributing to the wear. So we start with the centrals. I'm going to increase the length. There's been no modification to this model, so I'm bringing these teeth out more facially as well. I'm increasing the overjet as well. And so now I'm moving this patient into protrusive. This, you can see protrusive on the left before the length change, protrusive on the right with the additive wax, and notice more posterior tooth separation. Once I accomplish the disclusion and my incisal table on my centrals, I now go to the cuspids for my function, and I'm going to design my cuspids to create disclusion, one side and the other side. So let's go back and now look at functionally my proposal in wax. So we have our incisal table on the incisal edges of the centrals, and understand why we want that incisal edge. We want that table. We want thickness to prevent breakage. You know, occlusion means nothing until a patient breaks something. And so when we don't have this incisal table, we have unsupported ceramic. And I don't mean unsupported in just centric and the beginning of centric or disclusion when they slide out, because this is still going to put our ceramics under compression. What I'm talking about is when we come up to the incisal edge, now this is a pure shear position. So if forces are created as we move laterally on a sharper edge, not a flat table, this can create a shear force which can result in broken ceramics. And this is why that incisal table, which is an essential part of morphology, is created and followed. It's important that we design our cases, and if you look at some of my discussions on occlusion, that we want to design mechanically the front teeth to work with the TM joint, that the condylar path of inclination. So we should be taking check bites, we should know the condylar pathway inclination, and we should use adjustable incisal tables to mimic those. Now, I like this wax up so well, but it photographed not very well on pink stone, so I just poured another model in Yellowstone and re-waxed it, and you can still see I've done no facial reduction on the model. I've just simply added wax, and this is what I'm going to propose to the patient. And here it is mocked up, and again, I think that the incisal displays look good. I think the proportions look reasonable. The transition into the back teeth look nice, and the patient overall was very pleased, and this is what we decided to go with. So, sorry we're using a polarized version here of my preps, but I wanted to share with you that the preparations came wrapped well over the incisal to the lingual of the laterals and cuspids to help with the disclusion that we've created, so we get nice compression in our restorations so that they don't break. And now we can evaluate the hieroglyphics of our articulating paper, and this is where we ended up with. Okay, so we have cuspid disclusion, lateral. That's nice. We have protrusive starting on the laterals and then getting picked up by the centrals. But the most important part is this incisal table. And let's look at how flat this is. So now the patient can glide around left and right, forward and back on the table of the incisal edges. And this will protect the ceramics. And this is critical. So let's look at it protrusive on the top, laterals on the bottom, right and left laterals. And you can see that that table allows the patient to function on the ceramic and keep it under compression. post-op smile, and I think this looks pretty pleasant. I think most people would be hard to determine that any restorative dentistry was done. And you can see the laterals are slightly rotated behind the centrals. The centrals, if you notice and you're really critical, they're a little higher in value. They're a little bit brighter than the adjacent teeth, and that was done with intent. And the reason we did that is we talk about color. When we make big color changes with just 6 veneers, we make them whiter, they look bigger. Anything that's brighter looks slightly bigger. So by using a little bit higher value on the centrals, it gives them, again, a little bit more dominance and kind of makes the smile look more pleasing. So that's another trick you can use. You can use value to make teeth look a little bit bigger, or if you darken them, they'll look a little bit smaller.